Now, with medications, and I know it's tough to imagine, but they should all be prepared in their own individual cup, and you'll find this information in that article. We do not combine all of them, mush them together. That would be like a little science experiment, and we're not going to do that. So the first one I have here is my diazide. Now, since I'm going to be handling these medications, I'm going to put on gloves. I have to pop them out of the package, and I have to, prepare them. So, take the diazide one last time, making sure it's exactly what we need, because I'm getting ready to throw this away. Already, the capsule has somewhat started to pulverize, and you may encounter that in your demo. Just don't even miss a beat. All that powder goes into the cup. You've got your gloves on for a reason. That goes into the cup, and then we do our best to break this capsule open. Sometimes they slide nicely apart, sometimes they don't. But we do our best to get all of the powder out of that capsule. The capsule is not part of the therapeutic medication. It's just the vehicle for it. Taking a look to see, and sure enough, I've got a little chunk of capsule in there. So I'm going to, I don't know if you can see that, but I'll show it to you. That would never go through your tube, and that's not going to dissolve in water. So I'm just going to set that aside, and that's why I like a clean pair of hemostats handy. I'm looking, and I don't see any other here. Next up, I don't know exactly what to do with that. They're a little powdery. I've got my warfarin. Okay, this one's going to be crushed. What we need to do when we're going to crush a tablet is to make sure that our crusher is clean. Now, in the interest of time, I cleaned this ahead of the video. So we always want to use a clean one, and you always want to leave it as clean as you found it. All right, so the tablet goes in there, and with this particular crusher, you just push it down together there, and hopefully, let's see what we're getting. You see some of that orange coating? That will never dissolve in water. So do our best to pulverize this. And then what I'll do again with the hemostat is to pluck. I'm going to just put it on my tray here so I don't make too big of a mess. You could also keep a third med cup handy to get all this out. But our mannequins and our G-tubes will definitely plug up with this. So we want to get as much of this out as you can. And keep in mind that you've got a 30-minute time limit for this, so you want to do your best. All right, got most of that out. Now, that's done. I'm going to verbalize that I would clean this, but in the interest of time, and this being a 30-minute return demo, I will not really clean that, and you won't have to clean that for your faculty. Okay, so I've got my two medications, my powders, and then I'm going to set this aside, and I'm going to get ready to pour my Robitussin. I've got my 10 milliliters marked for those of you who might have, you know, for whatever reason, you're visual, you'd rather have it marked. You can use your Sharpie to mark the 10 milliliter. And what I'm going to do here is get it eye level, and I'm going to palm my label. I'm going to be ready with a tissue so that I can wipe. And I'm going to get down here, and I'm going to pour. Nice. Okay. Using a clean tissue to do that. And I will put the lid right back on. All right, so the third check is one last time checking before you put it away. And the Coumadin and the diazide. There they go, they're in the garbage. This is my little garbage stack here, don't mind me. So now what I need to do is I need to mix these with water. Now I've already checked the blood pressure and I've already checked the labs related to these medications, so I know I can administer them. You need to verbalize that to your faculty. My blood pressure, his blood pressure is 120/80. It's safe to administer this. And his INR is 2.0. It's safe to administer his warfarin. So I only want to put as much liquid as it's going to take to dissolve this because I don't want to create an overfull situation for the patient. So we'll pour a little bit of liquid here. That looks about right. Another little bit here. And just so that I don't have to fool around in the room, I'm going to prepare myself a couple of cups of about 15 to 20 milliliters of pre-flush. And this will be between flushes. And you know what, I'll fill this one all the way. But you can flush before and after and then between the meds. And if not, worst case, I know I have liquid in the room. So then I need a tongue depressor to stir my medications. This stuff likes to float, it doesn't like to dissolve. Oops, I spilled some on my tray, and that may happen to you. We do not start over for minor spills like that, just so you know. You want to do your best not to get too vigorous. And then I'm going to go this way with this one, not mixing the medications. That one dissolves nicely. So I'm going to bring that with me because I may need to do that again. So I've got my water over here, my Robitussin here, my 2 other meds here. I'm ready to go to the patient's room. I'm going to remove my gloves. And I'm going to do hand hygiene. And I'm going to go to the patient's room.